Are you facing challenges in your health? Then Dr. Suleiman Clinic and Labs is here to provide you with the lasting solutions to your health problems. Dr. Suleiman Clinic and Labs is specialized and offers consulting in psychiatry, internal medicine, cardiology, urology, dermatology, gynecology, infectious diseases, and infertility. At Dr. Suleiman Clinic and Labs, we offer 3D/4D scan at just 5,000 francs, emergency ambulance, free ultrasound scan, and free medical consultations. Our staff is composed of well-trained doctors with good laboratory and best equipment. We are located in 2 cities, Boya at Mile 18 Bolifamba, and in Douala, we are located at Entre Pilot. You can reach us through the telephone number 694-940-172. Your health is at the right place with Dr. Suleiman.
Ejaculation, fast ejaculation, premature ejaculation, fast discharge, all the same thing, is a learned behavior. You have learned during your past years and past experiences to ejaculate fast for one reason or another. Maybe out of fear, maybe out of too much anxiety, maybe you're afraid this will see you, maybe they're afraid this will hear you. For whatever reasons, your brain has just learned to ejaculate too fast. So what I'm gonna do with you, I'm gonna give you one tablet that will delay ejaculation till you condition your brain not to ejaculate fast. How is that? The tablet will give you prolonged period, delay the sexual intercourse with your woman. Meanwhile, you're gonna practice what is called a stop and go technique. What is the stop and go technique? The stop and go technique requires you and your wife to be together because you will practice the stop and go technique together. When the man is about to ejaculate, he stops, he comes out, and the female squeezes the head of the penis till no blood is there. Then you go. So it has to be successful communication between the man and the woman. I'm about to, okay, you come out, then she does it. So it's communication between both. She controlling her orgasm, he is controlling his orgasm, not to ejaculate fast. Can this happen at the first setting? Impossible. It requires training and conditioning, and after this you will not need the tablet anymore because you can control the timing in your head. After successful completion of this practice, the stop and go technique. Stop and go, stop and go. Who controls the stop and go? The female. So the female has to know, you cannot do it in secret. Oh, I'm doing it behind her back. Doesn't work like that. It takes two of you to understand the technique, understand your needs, understand the problem, and then both of you will work on solving the problem. That is the stop and go technique, and that is the best treatment for premature ejaculation. The tablet and the medication we give you is just to help you. Help you with what? Gain confidence that you can do it, and then you will do it. 1 time, 2 times, 3 times, 10 times, 20 times, 50 times, it doesn't matter. You will get there. You will get there, okay? You will get there. Now, second thing is we said about erection, man or a woman, excitement, the arousal phase, relaxation. You know, your nervous system has what is called parasympathetic and sympathetic. You have to be in fully parasympathetic. In simple English, you have to be fully relaxed, no stress, leave work behind, leave all the stress in your life behind, and focus now. We're gonna have pleasure moments, me and my wife, and we need to be very relaxed. Now, Doc, can I take some alcohol to help me relax? Well, you think you're gonna be relaxed with alcohol, but alcohol, initially, it gives you inhibition. Alcohol gives you inhibition. Inhibition mean what? You don't really care about anything. And initially also it gives you good sexual performance and delay. Like tramadol, it gives you the same thing. Initially, at the beginning, it gives you that, okay, I'm taking tramadol, I can delay the ejaculation, right? Initially. But once you do it too much, now it causes really bad impotence. So I like things to be natural. Natural. Alcohol is an enemy of sexual function, good sex. Tramadol is an enemy of good sex. Initially, you may use them and you will have fun, but the problem is addiction. You use them once, twice, 3 times, 5 times, you're already addicted. So you cannot do sex without tramadol, and you cannot do sex without alcohol. You understand what I mean? And that will turn against you. That will turn against you. So do it natural. Do it natural. If you have fast ejaculation, we help you with that one tablet till you condition yourself. And now both of you, husband and wife, you have to practice this together. And at one point, you will be able to control your timing together. You cannot have orgasm and your wife haven't even just about or didn't have or doesn't know what orgasm is. This is a failure in a sexual healthy life. It's a failure. So you have to adjust yourself. The wife has to be satisfied. And satisfaction of the wife is about understanding each other very well, communication with each other very well, even to the point that this is the point where I'm going to have an orgasm. You have to understand both. Okay, we do the stop and go technique like the doctor say, and everything will be okay. Okay, it will take time. Please, I cannot take calls. Do not call. Send me the message, and hopefully I will have time to answer a couple of them before I go. So we understood, right? We understood a good sexual healthy life is about communication between a man and a woman. Now I get a lot of questions, Doc, I have a micro penis. My penis is very small. And I tell you something, the size of the penis is the last thing you need. You only need it at intercourse. But the foreplay, the arousal phase, the desire, everything else has nothing to do with the size of your penis now. All the phases that you have just mentioned has nothing to do with the size of your penis. If you have a, normal size penis, it's okay. If you have less than normal, it's also okay. Oh, can I do a surgery, doctor? What medication is available for that? There is no such medication available for that. All those ads you see on Facebook and Google or on internet in general or here on TV, not here on this TV, I mean other TV channels, take this to do this and take this to do that. This is all fake. There is nothing can increase the length of the penis or the diameter of the penis, except only one thing, which is, surgery. We cut the ligaments for the penis, okay, and then that will give you about 4 centimeters length. And it's a surgery that is only done by a professional surgeon that knows what you're doing before you lose the whole thing. So, do not have yourself hooked on the idea, my penis is small, I cannot have sex. This is what we call psychological reasons for impotence, for sexual weakness, because you strongly believe that the size of the penis has a lot to do with your sexual performance. It does not. It does not. You can keep the woman happy without even, a penis, right? I mean, I'm not talking about, eventually you're going to have sexual intercourse. Let me give you an example. Those guys that are 100 years old and, they have complete failure in erection. We insert implant inside the penis with a small vacuum on their side. They press the button, they get erection. They press it again, the erection goes. Now, with this mechanical erection, the implant that we put in their penis, and they have erection or no erection. By the way, it's 96% success. Those who tablets didn't work, other means didn't work, injections didn't work, we have a last resort, which is the implant. We put an implant there, and with a small button in your size and your waist, you control erect, no erect, no erect, okay? Okay. This is mechanical now, right? So they have very good erection. This is implant, okay? It's successful, it's very, very much successful, and satisfaction is to the max. They can, they just erection now, right? So can these really satisfy the woman? Yes, some sort they can satisfy. Can they ejaculate? Most of the times, no. Can they have an orgasm? Most of the time, no. So what good is it? He gets the pleasure from his woman having the pleasure. I get a lot of men, I'm just doing it to satisfy her. And how you get your pleasure? Because she's satisfied. So if she's satisfied, I'm satisfied. If she's satisfied, I'm satisfied. A good responsive woman will give the man pleasure equal to orgasm, okay? Now we're going to go to the last phase, which is the pain phase. And we discussed this the last time, but maybe quickly. The pain phase is, for example, a woman that is, have a dry vagina, Like who? Like a lactating woman, for example, and a postmenopause woman. What is that? What is the common thing between the two? Low estrogen state. A lactating woman has a prolactin that is high, while the postmenopause woman have failing ovaries. The ovaries have failed, and the ovaries are the source of estrogen. So if I have lost the source of estrogen, I have low estrogen state. And if she has high prolactin, that will be working on opposite direction to her normal estrogen. That means the prolactin inhibits, decrease the estrogen. So we have equal states. We have one, ovaries failing, that's why you have low estrogen, and we have the other lactating woman, estrogen is low because of the high prolactin that is responsible for secreting the milk that the baby suckled. Okay. So what estrogen has to do with anything? Estrogen is very important to the sexual function, very important, because it has to do with the blood flow. Estrogen increases the blood flow to the clitoris, to the pelvic floor, and as a result, when I increase the blood flow, obviously I'm increasing lubrication. The glands that's in the vagina secreting those mucus needs to eat, and their food is blood. So if I increase the blood flow to those glands, they will work better, and they will function much better, and they will increase their mucus that they secrete, and the vagina will be wet. So if I fail to lubricate, then I will have pain, then I will hate sex, then I wouldn't even want to think about sex when it's accompanied by pain. But there is also psychological reasons. For example, men, some psychological disorder, men think that the vagina has teeth, and if they go inside it, the vagina with the teeth can cut off the penis. This is a psychological disorder now. So you have now to stay and do behavior therapy and psychotherapy and convince that poor guy that the vagina doesn't have teeth and nothing is going to happen to you when you enter the vagina. We have also what is called, when the pain is too much, the woman learns to contract the outer third of the vagina. That is very difficult to penetrate now. Even with a hammer, you cannot go inside, because she is contracted so bad, nobody can go, nothing can go inside. So this is, with again, psychotherapy and behavior therapy and, a little bit of techniques, small techniques that work. But those are the extreme cases, they are rare cases. They're not so many. So we're not gonna spend time on rare cases, on things that maybe you have never seen. Some of the times because of religious reasons and religious feel of guilt. Some things like this would happen that is manipulated or that is generated by the head, but it's not real. It's generated by the head. So, I'm getting few minutes left. I had a video to show you, but I think I don't know if it's gonna allow us sometimes. Let's just play the video, please, Mr. Bola, and
we'll. I can't remember this shout. I used to shout at midnight. But the thing passed me because I started shout for midnight only one time for 1 month. But today night I shout like 4 times. And when I shout, I go toilet. I piss or I expect. In the morning I be confused a bit. Yes. Then I weak, my skin weak.
Do you remember when you wake up after the shout? Do you remember that you have shouted?
Yes.
You remember?
Yes. Even when I shout the first time.
Yeah.
I don't know the time when I want to start. But the second time I know when I want to shout, I look my.
Do you eat in your dreams?
No.
You eat in your dreams?
Yeah, I used to eat with my dream. Like yesterday, then.
Before yesterday,
yes.
Did you eat in your dreams?
Yeah, I used to eat with my dream.
Too much? Not too much?
Is that sick power? I used to see it too much.
Yes. So do you have sex in your dreams?
Yes.
How often?
Too much.
Translate for her. How often?
How many times will you get sex with your dream?
If you plenty some night, I've always seen a baby. When you do and something, you find me. I did like him. When I woke up better, I ask my husband, I don't do so. But I don't want to catch my husband. Let me know if I not one sec. When you want even do it for me, they beg. So then they take my power.
She doesn't, you understand them? She doesn't like the husband to make love to her.
She only likes those spiritual ones.
Yeah.
So listen to me very carefully now. Do you like or you enjoy the sex with your own husband or no? All right, so this is a case that she shouts. Please play the next video. And you know, she had the attack right there in the hospital. And I'll explain to you in 2 minutes. I don't know if we have just the second video ready. If not, yeah, here it is. Can you hold this for me? What's wrong? Okay, this is briefly in 2 minutes. That's an epileptic case that is spiritually induced, okay? We can also have abnormal EEG in this, but definitely it's a spirituality disorder, has to do a lot with it, actually. If you see, I looked when she had the attack there. I was very lucky because they never videotaped the attack. My advice to you out there, if you have somebody, a friend, a family member that have any kind of those attack where he fall down like that, I want you to make a video. And in the video, I want you to look at the eye. Does he have the attack with the eye open or the eye closed? That makes a lot of difference because there are 43 types of epilepsy. Some of them is psychogenic, is not even true epilepsy. Psychogenic from the head, psychogenic, psycho. Okay, and there is true epilepsy. So I need to know if you have somebody and having some kind of events like that, I want you to film the attack and focus on the eye. Drooling or no drooling, the teeth, how is the condition of the teeth? Both sides are trembling or not, or just one side, and how long does it last? Okay, that's very important for me to give good information to the doctors who will be able to evaluate, because epilepsies are kinds, and among which the spiritually induced epilepsy, okay? Like this case has something to do with the spiritually induced, right? And also, you can see the drooling, so she has the attack. But the question is, when she fell, why did she fall like this? Like she was careful not to hit her head. So that's the question, eh? Because if you have true epilepsy, you will fall anyhow, like not in a protective position. Oh, I don't want to hit my head, so that's why I'm having my elbows like this to protect my head. That is not true epilepsy. That is not true epilepsy. Because if it was true epilepsy, she will fall, boom, she will hit the ground, and in the position where she was standing. She will collapse right there. No, not in a protective position and not with the eyes open. Okay, so that makes a lot of difference to your specialist. He would know how to categorize the disease. It seems like, you know, we have not discussed this very much, but it will be a totally different topic about epilepsy and seizures and convulsions and what kind of seizures we can get. And the most important advice from me as a physician here is to make a videotape and focus on the face and on the eyes. Are they open or they are closed? How long does it take? Does the patient remembers the events before and after, or doesn't? You know, so I ask her after this event, the patient doesn't remember. So that means something to me in my diagnosis. Now, there is one thing I want to mention in the last 2 minutes here, very essential. Some of us are financially, you know, unable. We don't have the money, like this kind of patient here. She doesn't have. I barely give her an injection and a sachet of medication till she cannot afford the price of the medication. She needs some investigation to be done. She cannot afford. So my call here for those who are financially blessed, if you can contribute to help sponsor somebody like this, you'll be blessed. You'll be blessed. So anybody, we have a list of them that they are financially disabled. Okay, and they need help. We help as much as we can. You know, my consultation is free. It has always been free. My first ultrasound is free. It has always been free. Okay, but there is also people out there that like to help people and they don't have the opportunity. Here we are. We offer you the opportunity. Come and visit us, sponsor a patient or two, and God will bless you by helping others. Okay, there are really some people in deep need that if you've blessed, please, you can help. Thank you very much for today's session, and I hope you learned. And if you have any questions, you can send me WhatsApp. I answer all the questions. I grouped them up and I talked about them as a general topic. And you have a very nice and beautiful weekend. May God bless you all. I'll see you next Saturday, 5 o'clock. Thank you.